Adderall is a stimulant prescription drug made up of amphetamine and dextroamphetamine. It's primarily reserved for individuals with ADHD or narcolepsy to enhance focus and alertness. For those without conditions, however, the drug quickly became one of the most common recreational drugs, especially among college students, and suddenly, its newfound purpose is to boost GPAs. Unfortunately, this leaves too many people in the dark of Adderall's actual negative effects beyond its recreational use. So, let's set that record straight. First, people assume that because Adderall is a legal prescription drug, it's safe to use anytime, anywhere. Most students believe its stimulating effects can help them study more effectively while also completely ignoring the risks. This greatly increases the impact of side effects from the drug. Adderall works by increasing the brain's production of dopamine and norepinephrine, which, according to Dr. Lake from Healthline, increases concentration, focus, and reduces impulsivity. However, this doesn't come without physical symptoms. According to Ellis from the Altamira Recovery Program, even when Adderall is used appropriately, side effects from taking the medication includes, but not limited to, headaches, insomnia, higher blood pressure and heart rate, and even death. In truth, a majority of people that misuse Adderall do it for the stimulating effects rather than the high itself. Referring back to the topic of college students, the drug simply helps them stay awake longer and focus better when completing their assignments. And that leads onto the next misconception. Even if side effects are well known, some people might conclude that Adderall is only dangerous to their physical health. Ellis also notes that Adderall immensely boosts the effect of neurotransmitters than caffeine and nicotine. And Dr. Gavin from Kids Health reiterates that this change causes the individual to feel energized for a couple hours, only to experience a crash a few hours later, to feel sluggish, disconnected, or even depressed. The truth is, Adderall produces a massive effect on brain activity, and it could especially worsen among college students that continue to use it to boost academic performance with every subsequent dose. And that's our third misconception, that Adderall will make you smarter. Although the drug is known to stimulate the central nervous system, including the brain, in reality, the increased attention span and the prolonged wake hours won't make you better at school. The schoolwork is undeniably one of the most common sources of stress among college students, and too often they are forced to pull all-nighters to complete their assignments before the due date, making them more sleep-deprived, and they lose focus and motivation to complete their new assignments, and that vicious cycle starts all over again. And when we include Adderall as this magic pill for higher grades, the life-threatening consequences of that cycle become more apparent with every pass. Thus, it puts them at a most risk of developing an extreme dependency for Adderall. And this leads to the last misconception, that Adderall is fine as a casual social drug. Not only is there an academic dimension to Adderall, but there's also a social element, which once again demonstrates how easily obtainable the drug is on college campuses. According to Dr. Saizon from the American Addiction Centers, he states that college students can abuse Adderall to become more comfortable and talkative around friends and stay up longer at parties. But that increases their likelihood to binge drink alcohol alongside the drug, which only escalates the deadliness of the drug. Synergistically, the stimulant effect of Adderall increases heart rate, blood pressure, and irregular heartbeat from the stimulant, and the depressive effects of alcohol lowers inhibitions, which could lead to harmful behaviors. Unfortunately, the path towards Adderall addiction is similar to opioid dependency. For those considering to take the drug or already must put their own health and mental well-being first when making decisions that will influence their own lives and the lives of others. In other words, taking shortcuts only increases your chance of developing lifelong dependency, not success. Thanks for watching.